Hey, hello lovely people. Welcome back to my YouTube channel. This is Glory or Nursekirea once again. And in today's video, we are going to learn about danger signs in pregnancy. All pregnant women together with their partners, relatives and friends should be aware of all these danger signs so that they can be able to save the lives of their loved ones. So guys, if you're new here, please do not go without subscribing, liking, sharing, and even feel free to share this video to as many people as possible. These danger signs could be indicating a serious condition that may be putting both the life of the baby and the mother in danger. So there are several of them and I would love to share some of them with you. And number one danger sign is vaginal bleeding. This vaginal bleeding could be light, could be heavy, could be spotting, but all of them are danger signs. So when you see one of them, you should rush to the hospital because this vaginal bleeding could be a sign of early miscarriage or abortion. It could be a sign of a condition called placenta abruption, and this placenta abruption refers to separation of placenta from the inner lining of the uterus. That means it could be separated completely or partially. So this partial or complete separation of the placenta from the uterus may lead to bleeding, which may be very serious and very dangerous to both the life of the mother and the life of the baby. This placenta abruption could be caused by a lot of things, especially a fall or a blow to the uterus. That means you should run to the hospital so that you can save the life of your baby and also your life. The other danger sign is severe headache. And I know during pregnancy you might be having headache here and there now and then, but there is this severe headache, especially if it is accompanied by blurred vision. And blurred vision is when you do not see things clearly. Either they are close or far, you might be seeing them, but they are not very clear. So if you have a severe headache together with this blurred vision, please do not even think twice. Run to the hospital and let the doctor or midwife attend to you. This severe headache could be indicating a lot of things. You might be having a meningitis, you might be having a high blood pressure, low blood sugar, dehydration, so in danger. So if you have this severe headache, don't even try taking some medications without going first to the hospital and let the doctor examine you and know what is causing this severe headache. The other thing is severe abdominal pain. I know also during pregnancy you might be having discomfort in your abdomen, maybe some pain, but there is this severe abdominal pain. And severe abdominal pain may be a very bad sign because it can indicate early abortion or miscarriage. It could be an ectopic pregnancy, which is maybe I will cover it in another video. That is the pregnancy which is attached to the fallopian tube instead of the uterus. This can be very painful. This severe abdominal pain also could be a sign of urinary tract infection, so you should run to the hospital so that you can get treated and carry your pregnancy safely. So there is another danger sign that is might seem to be very common or very normal, that is fatigue. When you feel a lot of fatigue, you feel you are very tired, you feel it's like you are sick to an extent that you are not even able to get out of your bed. Please do not take this as normal. Rush to the hospital because you need to be attended to by the doctor. This fatigue could be indicating also a low blood hemoglobin level, that is HB, which means the HB level should be at least be 11.5. If your HB is lower than 10, it could be dangerous because as we all know that during pregnancy or during labor, when you're going to get your baby, you lose a lot of blood. And if you lose a lot of blood and at the same time your HB is low or your blood level is low, it may cause or pose a danger to your life, because you may get a condition called PPH, that is postpartum hemorrhage, which is the most common cause of maternal death. So please, if you feel this fatigue, if you feel you're sick and you do not know what is really happening, rush to the hospital, let the doctor check you and give you medications if there is need to. The other danger sign is fever, and fever means high temperatures. So during pregnancy, you should always be checking your temperature, and you might not be having a thermometer at your house, but you can use this side of your skin to check your temperature or feel your temperature. So if you feel the temperature is higher than normal, please do not take this for granted. Just run to the hospital and let the doctor attend to you. This fever may be indicating a lot of conditions. You could be having respiratory viruses, you could be having pneumonia, you could be having severe malaria, you could be having severe meningitis. So please do not stay at home if you have fever. Rush to the hospital and let the doctor attend to you. The other danger sign is reduced fetal movements. Yeah, so if you're pregnant or if you've ever been pregnant, you know that the baby in your belly always kicks. So if you get to know that the baby is not kicking or the movements have reduced, for example, if your baby do kick every day, 5 times a day, 10 times, and this baby has reduced the movements, and please do not take this for granted. Just run to the hospital and let the doctor attend to you. Reduced fetal movements could be indicating a lot of things, including the fetal distress. The other danger sign is swelling, and this swelling could be include your face, your fingers, your limbs, that is your legs, and it is very, very severe. During pregnancy, during the last trimester or the last 3 months, most people have their swollen feet, and it is normal. But there is this which is not normal, and this is which is not normal is when your feet are swollen together with the hands, that is the fingers, especially your face is included, and especially under your eyelids. The eyelids are very swollen. Please do not stay at home. So during pregnancy, you should be always checking your blood pressure, because this blood pressure, if it goes high, it could be a very dangerous thing. The normal blood pressure is uh, 110/70, but that is an average one. And the abnormal blood pressure is when your blood pressure is above 140/90. This should start to worry you, and please run to the hospital. And this is why the antenatal clinics or visits are very, very important, because during these visits, a doctor or a midwife usually takes your vital signs, that includes your blood pressure, your temperatures, listens to the fetal heart rates, do some urinalysis, HB level, which is very, very important, because all these things, when they are not normal and they are early, they are detected early, then your life and your baby's life will not be in danger. So please, if you see any of these signs, run to the hospital, rush to the hospital, let the doctor examine you, discharge you maybe on bed rest or medications if they are needed. I want to share some remedies that you could do if your feet are swollen. And number one remedy is elevating your feet. By elevating your feet, I mean that when you're sitting down, please make sure your feet is elevated. Use a stool or something that is high to elevate your feet, to promote a great blood flow that will help reduce your feet from swelling. The other thing is taking a lot of potassium. Potassium is known to regulate or balance the body fluids. So if you take a lot of potassium, this may help your body to be able to regulate the fluids and help your body not to hold to excessive liquid or fluid, hence reducing the swelling of your feet. This potassium can be found in a lot of foods and fruits. For example, you can eat lentils, you can eat a lot of bananas, the ripe bananas, a lot of spinach, you can take a lot of carrots, plenty of yogurt. All these things contains a lot of potassium. The other thing that you could do is reduce amount of salt or sodium. All of us know that sodium is associated with holding to excessive fluid. So if you take a lot of salt or of excessive sodium, this will tend to make your body to hold a lot of water, leading to swollen feet. The other thing is reduce the amount of caffeine. Caffeine is found in coffee. If you're a person that takes a lot of coffee during pregnancy, reduce this coffee because caffeine also is related to holding a lot of water. The other thing is uh, always be hydrated. Always take plenty of water, and this water could be found in soup, clean water, uh, yogurt. Yeah, a lot of these fluids you should take a lot of them, because I know this could be sounding like it is contradicting, but when your body senses that you are dehydrated, then it will tend to hold to more water to counteract the dehydration. That links to holding more water. And you take a lot of water and your body always stay hydrated, then your body will not hold to any more water. That means your feet, your face, your fingers will not be swollen. The other thing is about clothing. Please always wear loose clothes, comfortable clothes, including your shoes. Do not wear tight shoes when you're pregnant. Do not wear tight clothes when you are pregnant. These loose and comfortable shoes and clothes helps in flow of your blood without any restrictions. So if this video was helpful to you, please do not go without liking or subscribing. And if you have a question, let's meet in the comment section and let's discuss these things further. So I love you guys and thank you for coming back. Thank you for watching. Bye bye. God loves you.